guys, so my name is Leanne and I'm joined today by my colleague Thomas. And Thomas and I are both psychologists and wellbeing specialists here with Zevo Health. So today we're going to talk a little bit about burnout, so including what exactly burnout is, maybe how to recognize some of the signs of burnout, and then some helpful tips for prevention and ways to intervene, let's say, if you find yourself maybe on the path to burnout or think that you might be experiencing burnout yourself. So I'm going to start off today by talking a little bit about what exactly burnout is, okay, and how the idea of burnout came to be, essentially. So it's likely that you've heard of the term burnout before, okay? It's a little bit of a buzzword at the moment, and many of us will have experienced burnout at one stage or another, okay? So you're likely familiar with it, even if you might not know exactly what it is. So what do we mean when we refer to the term burnout? So the concept of burnout was first described or first came about in the 1970s. And at that time, it was really primarily examined in the context of occupational burnout in the fields of human services. Okay, so things such as healthcare, psychotherapy, teaching, anything to do with dealing with people in the course of your job. Okay, so the research later expanded then to other fields of work and found that these symptoms of burnout can actually be found across different occupations, right? Though it is most common in those dealing with people as part of their job. So burnout differs from stress in that stress is generally considered to be either short-lived or linked with a specific issue. So something like a looming deadline. Now, of course, stress can be over the longer term as well, but we're kind of speaking in general terms, okay? Whereas when we speak about burnout, we kind of mean that it will occur over time and, where you might begin to feel as if there's no way out, okay? So feelings such as exhaustion, despair, hopelessness, and just a general sense of apathy might be associated with burnout, okay? So it's that little bit more insidious, shall we say. So stress can actually intensify burnout, but it's not the main cause of burnout, okay? So just a kind of a distinction there, I suppose, because sometimes you might hear of burnout and stress being used interchangeably, okay? So essentially, burnout is not really something which happens overnight, but it develops over a prolonged period of time. Okay, so research would indicate to us that burnout involves incremental stages, though the specific sequence of those stages and the process of that is still a little bit debated. But most often, burnout is caused by problems at work, but it can appear in other areas of life as well. So things like parenting or in your relationships as well, you can experience burnout as well. Okay, so those same kind of symptoms would apply. So just to kind of give you a little bit of a definition around this. So the Mayo Clinic defines burnout as a special type of work-related stress, okay, a state of physical or emotional exhaustion that also involves a sense of reduced accomplishment and loss of personal identity, okay? And some of the kind of common factors or contributing factors to burnout are things like maybe a lack of control over the work that you're doing, maybe unclear job expectations, lack of general social support within your job, and a work-life imbalance as well. And also just to note, as we said, that burnout can occur in other areas of your life as well, okay? It's not just necessarily in the work environment. So now that we understand a little bit more around what burnout actually is and how that concept kind of came to be developed, let's talk about how you might identify burnout. Okay, so what are the symptoms? How can you recognize if you or somebody else might be on the path to burnout or experiencing burnout at the moment? Okay, so I suppose knowing those risk factors for burnout can be a really helpful way to kind of keep tabs on your own emotional well-being and your physical well-being as well, okay, and of those around you, perhaps if you're managing a team or even just looking out for your colleagues, okay? So, for example, if you have a heavy workload, say, and work very long hours and are kind of struggling with that work-life balance, or maybe if you're working in a helping profession, so as we mentioned, things such as healthcare, or if you feel like you have kind of very little control or even no control over your work, but there are maybe very high levels of pressure on you or demands on you for your performance within the job, those conditions may be things that might be placing you at a higher risk of burnout. Okay, so if any of those things kind of speak to you, it might just be worth kind of checking in with yourself and, seeing how you're doing around those different elements. Okay, and maybe taking a start to address those things. So another thing to note as well is individual differences. Okay, so individual differences will play a role in placing people at risk for burnout, along with other things as well. Okay, so certain personality types, for example, characteristics such as maybe low self-esteem, attitudes like perfectionism, or high job expectations may indicate a higher risk for potential burnout as well. Okay, so again, just checking in with yourself and seeing if you notice any of those things that might be placing you at a risk for burnout, or maybe the people around you, okay, or the people in your team. So emotional exhaustion as a result of burnout is associated with a lot of negative health outcomes. Okay, so reduced well-being, perhaps kind of unhealthy coping mechanisms, things like substance abuse, maybe alcohol abuse, food addiction. And then also, burnout, it can also deteriorate your mental health in terms of, being linked with anxiety, depression, loss of self-esteem, as well as that kind of physical health element. So it's also been linked with, concerns such as insomnia, fatigue, heart disease, high blood pressure, and also type 2 diabetes as well. Okay, so very significant impact of burnout, both on the kind of physical and the mental health spectrum. Okay, so it really is important to be checking in with yourself and those around you, to kind of head this off at the pass if you feel you might be on the path to burnout. So again, a little bit more around this. Burnout can be characterized by three main dimensions, shall we say. Okay, so there's exhaustion, cynicism, and then that kind of feeling of reduced professional ability, or feeling kind of reduced in your ability to perform in any area of your life, depending on what kind of domain we're talking about burnout occurring in. So if you begin to feel kind of exhausted, or you're starting to kind of hate your job, or having those feelings of dread, say, about going to work, and you're kind of starting to feel a bit less capable, or that you're not able to perform within your work, or you're kind of no longer kind of deriving or getting that sense of satisfaction or connection from your work, that might be a sign that you might be experiencing burnout, or on the road to burnout. Okay, so other common symptoms to look out for, perhaps kind of chronic stress, other kind of mental health issues that you might start to notice. So things like experiencing anxiety or depression symptoms, or also physical health issues as well. Okay, so things like headaches, digestive issues, emotional exhaustion, kind of feelings of numbness, despair, or on the other side of that, irritability, or kind of the reduced ability to kind of concentrate or focus. Okay, so I'd also just like to mention that, although the term burnout kind of appears to kind of indicate maybe a more permanent condition, particularly given that we've said it kind of comes on over a prolonged period, the good news is that it is actually reversible. Okay, so it can also be prevented or even mitigated by kind of taking some simple steps to kind of mind yourself and mind your well-being. Okay, so I'm going to hand you guys over to Thomaz now, who's going to take us through a couple of useful ways in which we can kind of safeguard ourselves and maybe salvage ourselves from that burnout. Okay.
Great, thanks, Jan. As Lian was saying, there are a few things that we need to consider when talking about burnout. So there are important things that we need to do to prevent. So there are, when you start seeing the first signs, as like you don't like your job anymore, that you're feeling exhausted emotionally, physically, could be about anything that you are experiencing mostly at work. So when you start seeing that, and that in some way it's affecting your well-being. And when I talk about well-being, I always say that your functioning is very important. So it's if it's affecting your sleeping, if it's affecting your appetite, and if it's affecting your mood. So that is something to start to consider, that there is something going on. And to prevent that is to actually look at yourself and your own needs. So pay attention on all those simple parts of your life, like sleeping, appetite, and get there to see, like, okay, how can I get my sleeping to be better? How can I get a better appetite, a better mood? So the small things, for example, while we work, take your breaks. Don't disconsider that. Then consider yourself, like, if there is a project that you would need support, ask for support. So there are a few ways to prevent that to happen. But then, as we are talking about burnout, if you see that you are already experiencing some symptoms of burnout, and it's being challenging for you, and it's being difficult, there are the 3R approach. That is recognize, accept that there's something going on, that there's some warning signs in your body that can be something to look at as burnout is starting. and then reverse. So undo the damage by seeking support and manage your stress. I will talk about some tips as well on how to do that. And then the third R is resilience. Build your resilience to stress by taking care of your physical and emotional health. That is extremely important. I believe that everyone that's watching this video and everyone that when we talk about burnout, we say, okay, I want to function at work. But then to function at work, you need to function in general. You need to function in your personal life as well, outside work. And that's why it's extremely important to consider the signs of your body, okay? So some ways to intervene, it's what to do then. So one thing that happens a lot when people are experiencing burnout, they isolate. So in this case, we would consider to do the opposite. That's the reverse part that I was talking about. So turn to other people, talk to friends and family, because even though you might say, oh, but I don't want to be a problem, be a burden to other people, but I am sure if you are talking to the people that love you, that people that care for you, you are not going to be a burden. I am sure people will appreciate that you are opening up and knowing that in some way they can provide the support to you. And then reframe to the way you look at work. Try to see the positive. For example, engage with your colleagues, try to find a balance in your working time. So take your breaks, take your time off, and consider that that's the important part. If there is there, it should be used. And that is a way to prevent, and if there is already signs of burnout, to actually to avoid that to grow. And then reevaluate your priorities. So sleeping and eating, as I was saying, should be the first ones to regulate your mood and your physical needs. So set some boundaries. It's very important when talking about burnout to set boundaries. I know that you might have been saying, oh, but there's a lot of work, there's a lot of projects and deadlines. And that's fine. It's part of the working environment. But setting the boundaries there is also important, because then you would be even more effective if you do take some rest. So consider that, put the boundaries of where to start, where to finish. And one thing that it's really important to regulate our moods and is great for our bodies is to exercise. So consider to take some exercise because exercise is a powerful way to overcome stress and burnout. Try at least 10 minutes per day. Now, if you go for a walk in the morning, in the afternoon, whatever time that you have, that will help you to be more productive and to reduce your stress and improve your mood. And one that I really like, that I believe it's something that it's quite common for anyone to forget these days, is to practice self-care. It is extremely important. This is the one that people most forget. So daily practice of self-care has been proven to be highly effective to prevent higher levels of stress and burnout. And self-care, it's quite broad. So what is self-care for me could be different. What is self-care for Leanne, and different for yourself that's watching. So take that, what you like to do, take those things into account that, okay, I really like to do that activity. Self-care for me is this or that. So those activities, try to remember. Sometimes because we forget to engage in them, we start to forgetting what is the things that I like. So tune into yourself again and do those things for yourself. Take that time for yourself. And meditate. So practicing meditation can help you to regulate your mood, tune into yourself, and to prevent future consequences of burnout, such as anxiety and sleeping problems. So meditation is extremely effective. And an important way that to look at meditation is to see as, let's say, brushing your teeth. You brush your teeth every day, more than once a day. So taking meditation as something as important as that you need to do at least once a day to help you to regulate your moods and to reduce your stress, and then consequently reducing the possibilities for you to find yourself burning out. And then one thing is important is to actually seeking support. Don't say that, don't see yourself as a superhero, because none of us are. And even though you might be extremely effective at work, and you see yourself in that way, there's nothing wrong to ask for help. There's mental health professionals, there is support out there from people that know what they're talking about and know how to help you. So if you suspect that you may be experiencing burnout, we encourage you to reach out for supports. Talking to family, as I said, friends, colleagues, can be a huge help. Or engaging with a mental health or medical professional for advice could be the first steps towards improving your symptoms and then combating the potential consequences of burnout and improving your well-being. So that's it from us. I really hope that you could take something important for your life from this video that we did, and I hope you enjoyed.
Thanks, guys. Take care of yourselves.